Joint pain at 40 isn't always a sign of aging, but if your doctor says otherwise, they might be missing something critical. Today, I'm going to reveal why 70% of women around menopause time will experience muscle and joint pain. And for some of them, these are so severe that it will mess up their daily life. What is even more frustrating is that many of these women have completely normal blood tests, they have normal x-rays and normal MRIs, and because of that, many doctors would look at the computer screen, will look at them, and then they're gonna say maybe it's stress, or this is just about aging. But you know something is wrong. You know that these symptoms are real and you are just in your 40s while you feel like you are in your 80s. So let's cut through the confusion and talk about what's really happening. I'm Dr. Diana Girnita, a board-certified rheumatologist, and every year I diagnose and treat many women who are entering menopause. And they are sent to me to be evaluated because they have joint pain and muscle pain. Now, worldwide, 47 million women enter menopause every year, and that's 2 million in the United States alone. That's quite a number, correct? That is why I thought this is an important topic to be addressed. When we talk about menopause, everyone expects hot flashes and night sweats, but almost nobody prepares you for what happens to the muscles, the joints, the tendons, and the bones. Picture this. You wake up one morning and your hands are feeling stiff. Not dramatically swollen, but just different. Your knees complain when you climb stairs. And that shoulder that never bothered you now is suddenly frozen. No, you're not imagining it. Your pain is not about aging. It's your body signal that something is changing. And it is actually your body responding to the biggest hormonal shift since puberty. Around the age of 40, your estrogen levels start dropping, gradually in perimenopause and sometimes dramatically in menopause. But why is this important? Because estrogen is not just about reproduction. Estrogen lubricates the joints, maintains the cartilage, builds up the muscles, strengthens the bones, and helps regulate inflammation. I call it the oil of your body's moving parts. This is why I tell my patients, if you feel like you are not hurt, keep looking for an answer, because what most of you are experiencing is now a new concept barely recognized by many doctors, and it is called the musculoskeletal syndrome of menopause. So what happens to your joints, to your bones, and to your muscles in menopause? Your hands, your knees, your hips, your shoulders will become more painful. You may experience generalized weakness, poor balance, and you may have an increased risk for falls. Your tendons will become weaker. You may also develop early wear and tear arthritis or osteoarthritis. Your bones will become weaker, and you can develop what we call osteopenia or osteoporosis. The average woman loses approximately 10% of her bone mineral density during perimenopause, and her muscle mass decreases by about 0.6% per year after menopause. Did any of your doctors mention about these changes to you? Drop me a comment below and let me know if you ever had a discussion about this with your doctor. So let me go even deeper and explain to you what estrogen is doing to your body and why losing it will change everything. When the estrogen levels decline, inflammation increases, muscle repair will slow down, and the bones start to lose minerals, which will lead to an increased risk of injuries and increased pain. However, this hormonal shift also activates the immune changes, which will increase the risk to develop new autoimmune diseases. And to complicate things even more, If you already have an autoimmune disease, like rheumatoid arthritis, the decrease in estrogen will make your joints feel worse, more sore, and you may develop even more flare-ups. But with all these new symptoms, such as symmetrical joint pain, especially morning stiffness, along with frequent sprains, tendinitis, slow healing injuries, fatigue, sleep problems, all of these are part of what we call the musculoskeletal syndrome of menopause. And what is even more frustrating, as I said, is that most of the labs are normal, and that is why it is important to meet a doctor who looks at you, who listens to your symptoms, and not only looks at the computer or just to your lab test. Studies have shown that 30 to 50% of women will break a bone due to osteoporosis after menopause, and 70% of hip fractures occur in women. So how can you prevent this spiral? You likely heard in your circles of friends about hormone replacement therapy, or HRT, and you wonder, what is HRT? Or is HRT risky, or is it safe? If you are like many women, you might be scared, as for many years there has been a lot of drama around HRT. About 20 years ago, there was a study called the Women's Health Initiative that induced fear that HRT might increase the risk of cancer and blood clots in women. And this study is now considered not to represent the reality. Why? Because the study primarily looked at women who started HRT later in life, around the age of 62, and the type of estrogen that was used was a synthetic type and a combination of estrogen and medroxyprogesterone acetate, which is not a bioidentical type of hormone that we use in our days. However, as I mentioned, the story has evolved with newer data and improved HRT formulations. Current research shows that starting HRT close to menopause, in the perimenopause time, with individualized plans, it's safe for most women. And there are 3 misconceptions that I hear every day. Number 1, HRT causes cancer, especially breast cancer. This is largely based on the outdated studies. Recent data shows up a 50% reduction in breast cancer mortality for women who have used HRT regardless of the age that they began therapy. And in fact, estrogen-only HRT actually will lower breast cancer risk. Combination HRT may have a small increase in the risk for the long-term use, but for healthy women in their 50s, the risk is very low. The second misconception that I hear a lot is that HRT leads to blood clots and strokes. For most healthy women starting HRT near menopause, the risk of blood clots or stroke is extremely low, especially when you are using modern transdermal like patch or gel formulation rather than pills. And number 3 misconception that I hear is that women who have migraines with aura should never use HRT. Migraine with aura is not an automatic contraindication to HRT. In fact, non-oral forms of estrogen, such as patches or gel, are often safely prescribed for women with migraines. Now, when it comes to joints, muscles, and bones, large studies have confirmed that HRT will reduce the joint pain, will preserve the muscles, will protect the bone density, and it will lower inflammation. So the bottom line is that for most women, HRT is much safer than widely believed. And when started at the right time and tailored to your individual needs, it can offer tremendous benefits to relieve your symptoms. Let me give you an important heads up. There are a lot of generic hormone clinics out there, and they are promising quick fixes for menopause and hormone problems. But the real menopause care takes more than just a prescription. It needs a proper evaluation, it needs follow-up, and a plan that is just made for you. especially if you are managing musculoskeletal symptoms and an autoimmune disease like rheumatoid arthritis, lupus, Sjogren, or autoimmune thyroiditis. That's why we have built the Women's Hormone and Autoimmune Balance program in our clinic. It's specifically designed for women in the menopause and perimenopause time, women that also deal with autoimmune diseases. And this is a unique opportunity that has never been done before. Here, you will meet specialists who understand how hormones and immunity affect each other. Every care plan is customized, is not one size fits all, and you are never handed a standard treatment. Our menopause specialist will offer you a full hormone evaluation and will tailor the HRT and lifestyle advice to your needs. If you want to learn more, just visit our website and reach out to our team. And now let me tell you about a few other options that can help your joints, your muscles, and your bones besides hormones. Number one, exercise. Yes, start resistance exercise, lifting weights or using bands every other day, and make sure that you do these exercises consistently. Engage in regular activities such as walking or swimming or yoga, because that will maintain your joints flexibility. Number two, start eating more protein to support and protect your muscles. And number three, if you start the supplement, make sure that you start vitamin D or vitamin D and vitamin K or even magnesium, because they support your bones, relax the muscles, and power your immune system. So, my dear ladies, your pain after 40 isn't about aging. It's your body signal that something is changing. Now that you understand what happens in menopause, it's crucial to see how these changes can directly affect a woman with rheumatoid arthritis. If you don't learn about this connection, you could spend years struggling in frustration, switching medication, and still not seeing the improvement that you deserve. In this next video, I'll show you exactly how menopause can trigger or worsen rheumatoid arthritis, so don't miss it.